Well, hospitals in the Midstate are slammed, and not just with COVID patients. Many local ERs are having to divert patients with mental health issues because they just don't have the capacity right now.
So what can people in crisis do to get the care they actually need? Kayla Schmidt joins us now. More on this story. Kayla.
Valerie, Alicia, Midstate doctors say these surges in people seeking help for behavioral health issues are common and they're to be expected. But with emergency rooms already crowded and hours-long wait times, doctors say your first call should be to your local crisis center. Problems people put off at the start of the pandemic are resurfacing, and the timing couldn't be worse.
18 to 20 months into the COVID crisis, we're seeing twice as many behavioral health patients coming to an ED for support than what there was at this same time in 2019.
UPMC and WellSpan are both sounding the alarm on crowded emergency rooms and say the uptick in mental health patients is adding to it.
We're seeing much more increased frequency of overdoses, suicidal ideations, depression, needing help. They're in crisis and needing admission or needing transfer to a mental health facility.
Over the weekend, Dr. Dale Brickley, Senior Director of Operations for WellSpan Philhaven, says many Midstate hospitals had no capacity to treat new mental health patients, forcing them to be sent elsewhere.
In our area, we have surges where those resources get used and individuals going to the emergency rooms, although they still get good care, that care is going to be delayed.
Brickley says calling your county's crisis center can help you get care faster. He also emphasizes people should seek care if they need it, but stresses the ER is meant for acute crisis situations. And both doctors agree the pandemic shoulders a lot of the blame.
COVID has impacted everyone's lives.
It's definitely adding additional stressors and more of them at once.
And Brickley says they're not going anywhere, so he encourages everyone to get help now for general anxiety and depression to help prevent a crisis in the future. And we have more details, including those numbers for local crisis centers on ABC27.com. In the newsroom, Kayla Schmidt, ABC 27 News.